Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of internal medicine is the benign and malignant diseases of prostate gland. We will discuss this topic in 4 sections. In the first section, we will discuss the prostate cancer itself, what are the benign and malignant changes that can occur in the prostate gland during the process of the development of the cancer. What's the epidemiology of the prostate cancer and what are some protective factors that can protect against the prostate cancer? And also what is the prevention and how we can prevent the prostate cancer? Then in the second section, we will discuss about the physical examination of the patient with prostate cancer or prostate hypertrophy. What's the screening test for prostate-specific antigen and also the prostate biopsy. Then in the third section, we will talk about the staging of the prostate cancer. And now we know that staging is very important for the actual diagnosis at what stage the cancer is and what will be the prognosis of the cancer. So staging, TNM staging is the most popular type of staging method for the cancer. So we will discuss the TNM staging for prostate cancer. We will talk about the CT scan and MRI and then bone scans. Then in the fourth and final section, we will talk about the very common condition in males, that's BPH. BPH is the benign prostate hypertrophy. What is benign prostate hypertrophy? What is the treatment of BPH? And what are the different surgical approaches for the treatment of benign prostate hypertrophy? So all this we will cover all of important information regarding the prostate cancer in this lecture. So keep watching sqadia.com to learn about this topic, a very important one as far as the male are concerned. So keep watching sqadia.com.